And to our VSU students, good morning, maayong buntag. And to our dear resource person, good morning, sir. To start with this, what we call a webinar for our student nurses, let us start first with an invitation to be guided from Almighty God with this day word. I would like to share a screen with the invocation. Let's put ourselves in the presence of the Lord. Dear Father, we thank you for everyone gathered here now. Thank you that you know each of us by name and have caused us to walk with you. We say that we are dependent on you and our trust is in you completely. As we surrender ourselves in adoration, we welcome you among us today and celebrate the gift of life that you have lavished upon each other. We ask that you would open our ears so that we may hear your voice. Open our minds so that we may receive your eternal wisdom. Open our spirits so that we may know your leading and guidance. And open our hearts so that we may receive your wonderful love. Lord, we thank you for the speakers and facilitators. We pray that you would give them great inspiration as they share with us what you have placed on their heart. We pray that you would fill them with courage and give them your peace. We ask all this in the glorious name of Jesus. Amen. So once again, good morning and welcome to this webinar entitled Your Drugs, Do's and Don'ts. And this is a very wonderful day for to us because we do invited a very knowledgeable resource person from the United States of America to share his expertise and his what we call wisdom in sharing to us or in dealing with nursing pharmacology. So to start with our webinar, may I call on Dr. Vivi Retno Intening to deliver an opening remarks.
Thank you, Master of Ceremony. Good morning, ladies and gentlemen. The Honorable STP Journey Maron Gules, speaker this web seminar today. The Honorable Dean College of Nursing, Visayas State University, Philippines, and all the faculty members, STIKES Bethesda faculty members, and all the participants who have joined our seminar today. The student of Visayas State University, and also the student of STIKES Bethesda Yakkum, Yogyakarta, Indonesia. A very good morning for all of you. Hope all of you in a good condition and also in a good health during this COVID-19 pandemic. First of all, let me take the time to thank the speaker for web seminar today. Thank you, Mr. Gules, for your time to sharing with us today. And actually, this web seminar is the one of the collaboration program between Visayas State University and STIKES Bethesda Yakkum, Yogyakarta, Indonesia. And hopefully, we can do such collaboration more often in the future so that we can share experience and expertise through many programs and events in the next agenda. And finally, I wish you well through the rest of this web seminar. Have a very nice and fruitful discussion in this web seminar. May God bless you. Thank you and enjoy this web seminar. Good
Thank you very
morning.
much, Dr. Viviret Tenning from the STIKES Bethesda Yakkum. To this part of this webinar, to introduce to us the resource person, may I call on Dr. Joel Ray Yakkum, the Dean of the Visayas State University College of Nursing, for the introduction.
Good morning, everyone. Thank you very much for attending to this one of the, should I say, rare opportunity to be joined with our resource speaker and doing this scholastic activity between two countries in Asia, in Indonesia and the Philippines as well. Uh, Actually, we have our MOU with STIKES Bethesda Yakkum, and this is one of our activities, many of the activities in the future, of course. For this morning, let me first send my virtual greetings to the head of STIKES Bethesda Yakkum, Vivi Retno Entening, and the Dean of Nursing, Dr. Nurlia, my good friend, the faculty and staff of Visayas State University, and the STIKES Bethesda in Yogyakarta, Indonesia. Our students and our friends who are watching live on YouTube this time, good morning. Let me give you a brief introduction about our resource speaker for this morning. He is a good friend of mine, a nurse by profession, a licensed nurse both in the Philippines and in California. Way back in 2012 to 2014, we were working together as clinical instructors in the College of Maasin in Southern Leyte. And after that, he went to Qatar, in Doha, Qatar, to work as an emergency room nurse in an American hospital based in Qatar. And from there, he went to the US, specifically in California, working as a case manager in several institutions. And one of that is in Kindred Hospital, and as a case manager in Advantage Health, Riverside, California. So I hope that we will all listen and will give a fruitful interaction after his discussion. Ladies and gentlemen, let us all welcome STP Journey. The STP here means serve the people. Journey Maraon Gullies, RN. Sir CP.
Thank you, Sir Joel, for the introduction. Yeah, you got it right that STP means serve the people. So it is true, me and Sir Joel were working together way back. Why did you tell the year? They will know our age now. So way back in 2012 and 2014. I'm one of the clinical instructors in the College of Maasin, and I'm currently working now in the US as a case manager for Advantage Health. I'm working as hospice clinic case manager for Advantage Health. So Sir Joel told me maybe last week, Sir Stipe, do you want to do a discussion? So I said, sure. Do you want me to record like a video presentation? And then Sir Joel said, no, it's a webinar. It's a webinar for students in VSU. So I said, sure. I'm kind of hesitant because I haven't done it in a long time, like maybe 6 years. But you know, I accept the challenge because I really want to teach also. I really want to educate young students to be good nurses in the future. So the topic that I would like to discuss today is about the do's and don'ts of drug administration. I specifically, because if you're talking about drug, let me just share my screen. Sorry, I forgot about it. So if you're talking about pharmacology, there's a lot of medications that you can discuss, but I specifically, focus on pain medications, and you will learn why it's close to my heart, pain medications, because it's getting these medications are one of the few medications that are usually abused in the world. And based on my experience here in the US, there's a lot of patients who are taking pain medications, and they're abusing it. So drugs, and before I will start my discussion, simple sharing of my experience and knowledge in pharmacology, I would like to congratulate first Sir Joel and the school in Indonesia for doing this webinar. And I hope that you're all of you guys are coping well with this pandemic. In here in the US, we're kind of a little bit scared also. Me personally, because we have a lot of cases here, especially in California. So let me start, and I hope everything is okay. I will be asking questions while I'm doing my discussions. I would like this to be like kind of interactive, because I am just looking at the monitor. So you can answer, or you can raise your hands and answer the question, because I have some questions that I put in with my in my slides. Let me start. So I've heard that from Sir Joel that from the VSU, you are like level 2 students. What about from Indonesia? Are the students also in level 2 or level 3 students? Can you hear me?
Yes,
Okay.
I can hear you.
All right, thank you. So I assume that all the students already had pharmacology, correct? Guys from VSU and from Indonesia, are you familiar with pharmacology, studying of medications? Before I start. Okay, I think it's a yes.
Yes, sir.
Okay. So drugs, do's and don'ts. Let me just minimize myself. Okay, so when we're talking about drugs, what are drugs? Medications. These are in a form of pills, liquids, injections. If you're familiar, if you're going to the hospitals, and for students, if you're going to the hospitals, you're seeing medications in a form of a pill, in a form of a liquid, in a form of injections, IVs, and everything. So drugs, do's and don'ts. What's going on? Okay. First, if we are talking about medications, we always think about the nursing rights of medication administration. It always goes to that. Whatever medication you administer, whatever what do you call this? Wherever or to what field of nursing you'll be working with, you will always go to the nursing rights of medication administration, in order for you, not to experience or not to do medication errors. So nursing rights of medication administration for nursing students, you have to learn this. Nurses have a unique role and responsibility in medication administration. Remember, between nurses and doctors, we are with the patients for like most of the time. Doctors will just visit the patients, but nurses, we are always with the patients. We're working 24/7. So nurses have a unique role and responsibility in medication administration. The doctor will prescribe the medication, the nurses will carry it out. So it's in your hands, nurses. how you will administer the medication safely. Nurses are frequently the final person to check to see that the medication is correctly prescribed and dispensed before administration. Right, it's not moving. Okay. So quick review. Before administering a medication, what would you do? I want an answer. How can you go back? Okay, before administering a medication, what would you do? For example, I have medication here. I'm going to administer it to patient Jones. What would you do before administering a medication? Anyone? Okay, so before administering a medication, there are key questions when administering medication. Who are you going to give the medication? What is the medication about? When can I give the medication? How should I administer the medication? And why should I give the medication? So who is the patient? This means the patient's age, sex, and mental status. The patient is, for example, me, Journey Gules. He's 33 years old. Oops, you know my age now. 33 years old. What medication is to be delivered to the patient? So for example, the doctor ordered paracetamol, 500 milligrams. So that's the medication. When can I give the medication? What is the appropriate time to administer this medication? So there's like orders, if you can see, if you'll be working in the hospital, unfortunately you cannot work right now because of the pandemic. You cannot go for your clinicals because of the pandemic. But when you're going to the hospital, you'll see an order says, when can I give the medication? The order says, give the medication once a day. Or the order says, give the medications twice a day. How the medication is administered. So there are a lot of routes that you can administer the medication: by mouth, by rectum, through IV, through injections, IM, subcutaneous, transdermal, intradermal. And why? What condition is the medication intended to treat? What is the response that is expected from the use of this medication? So as nurses, I really hate before when I hear nurses will say, sorry, I don't want to use the word hate. I really don't like when I hear some nurses will say, when the patient will ask, what is the medication for? And then the nurse will say, I don't know, let me ask the doctor. I'm sorry, I'm only a nurse. So I really don't like that, because as nurses, we are not limited with what the doctor tells you to do. We also have our knowledge about the medication. And remember, we are always with the patient. So we are the, let's say, frontliners to the patient. We manage the patient. We are at bedside. We are doing all for the patient. So if you don't know anything that a doctor will tell you to do, that's not a good trait of a nurse. So you always be prepared in the future, hopefully next year, if COVID will be gone, if we all have a vaccine and you'll be working with their clinicals in the hospital, it is really nice if you will study the medication first before you will give the medication, and you can answer the questions from your clinical instructors. That's really very impressive, that you can, if the clinical instructor will ask you, what is this medication for? And you will say, I know that. For example, Robitussin is for cough. So you have to know why you're giving this medication. And please do not say, I'm not sure about it, let me ask the doctor. Okay? So again, the key questions before administering the medications: who, what medication is to be delivered, when can I give the medication, how should I give the medication, and why am I giving this medication to the patient? What is his or her disease condition? Okay, for the next slide, is everybody okay so far?
Yes, sir.
Okay. Thank you, Mr. Allen. Thank you, Sir Allen.
You're welcome, sir.
Okay, so this one. A medication right checklist, the right patient. Check the name on the order against the name of the patient. Use two patient identifiers like the name and the birth date. These are commonly used. Now, for the new technology system, we are using barcodes here in the US, and we are also using the electronic medication administration. Before I left the Philippines, I was working in the hospital, and we are only using paper charting. But I've heard from my colleague that in my place where I live, that they are starting to use the EMR. So that's great because there's a lot of advantages for EMR. Are you familiar with EMR, students? Have you seen EMR in the hospital when you did your clinicals? So I think it's a yes again. So for right patient, check the name on the orders of the patient. Now what if you're in a ward and there are like 30 patients in a ward? And then, for example, one of the patient's name is Jones Albert, and Jones Albert, Albert and Albert. So they are roommates in a ward. Check the right patient. You're not going to give Lasix, or you're not going to give pain medication to Albert when Albert is the one needing it. So give the medication to the right patient. Check the name on the order against the name of the patient. So here in the US, we are using the name tags, you know. So we use the barcodes, and we check through the barcodes, and it matches the patient and the patient. Now you already verified the right patient. Next, the right medication. So it's like, oh my gosh, this is very overwhelming. You have a lot of rights to remember before I can give the medication. That is very common, especially for new students. Like, I remember the first time I was a student, the first time I was giving my medication when I was a student, I was really reading the medication back and forth. If this is correct, I'm reading the chart. If this is correct, I'm reading the patient's chart. Is this really Juan? Is this really Juan? Am I really giving the correct medication? That is normal. You get anxious. You get scared because that's the first time that you're giving the medication to your patient. But again, constant practice, practicing the rights, then you will learn, and then you will master it, and you will just think about like, oh, that was easy. That's just a piece of cake. So the right medication, check the medication label and check the order. So when you're, for example, I have a medication here. Let me see if you can see this. So I have Narcan. Who is familiar with Narcan? I mean, I know our clinical instructors know about Narcan. So Narcan, no, it's okay if you're not familiar with it. I totally understand. Narcan, I will discuss later what Narcan is. So check the right medication. You will see, okay, it's naloxone. For example, this is just an example, naloxone. The order, I don't want to, this is a real patient, so I'm gonna hide it. I don't want to give you, so the order here, Narcan 4 milligrams per actuation nasal spray. Narcan is usually used for patients who are overdosed with narcotics. Now, if you're asking what narcotic is, I will be discussing later. Okay, narcotic is for pain medication. is pain. I haven't seen any narcotics when I was in the Philippines, but when I started working in the US, I've seen a lot of narcotics, just like you're giving candies to your patients. Okay. So write medication, check the medication label, and check the order. Narcan, how are you going to check the medications? Okay. So you already have the right patient and the right medication. Next, watch out for medication that sounds alike. Now, students, if you'll be working in the clinical area, you will be, if you're asking me how many medications, you're asking me medications from A to Z. You have a lot of medications from A to Z. Medication sounds alike. Keflex, Keppra, Clonopin, Clonidine, Lanoxin, Levothyroxine, iodine, codeine, lorazepam, clonazepam, oxycodone, hydrocodone. So you'll be, it's like, oh my gosh, I'm gonna be overwhelmed again. There's a lot of medications and I don't wanna be committing a medication error. Again, go back to your rights, right patient, right medication. You have to watch out for medication that sounds like and looks like. Keflex, Keppra. This is not, this is not to overwhelm you guys, but really in the real clinical field, you will be looking at a lot of medications, especially if the patient is what we call polypharmacy. When we say polypharmacy, patient who has a lot of medications from 1 to 20. So they're patient, we call it polypharmacy. So be careful. Again, right patient and right medication. And watch out for medication that looks alike and sound alike. Next. Okay, the right dose. So I have samples here. There's 150 milligrams per day, 300 milligrams per day, 450 milligrams per day. For example, clindamycin. Clindamycin 150 milligrams. If the doctor will say clindamycin 150 milligrams, 3 tablets, how many milligrams is that? So that will be 450 milligrams, right? So you have to check the right dose. Check the order again, go back, confirm the appropriateness of the dose using a current drug reference if possible. If you're unsure of the medication, students, you have to ask your clinical instructor. If you can't find your clinical instructor, don't ask your classmate. Go find your clinical instructor, go ask the nurse. Collaboration. You can also, in the real setting, if you'll be a nurse soon and you don't know the medication, verify it with a doctor. If you can't get a hold of the doctor, if you can get a hold of the doctor, you can verify it with the pharmacy. Pharmacists, they're very knowledgeable with medication. You can always verify. Is this correct? Is there a medication for clindamycin that is 450 milligrams? And then the pharmacist says, yes, there is. Okay, but it's usually 150 times 3, 450. Next. So are these the same? So take a look at the sample of order. Losartan hydrochlorothiazide, 50 milligrams, 12.5 milligrams, 1 tablet by mouth daily for hypertension. And we also have losartan hydrochlorothiazide, 50 micrograms, 12.5 micrograms, 1 tablet by mouth daily for hypertension. So they are different. But sometimes if you're working as a nurse, it's very fast. Boom, boom, boom. You're working very fast left and right. But do not forget the rights in giving the medication. So the correct dose for that is losartan hydrochlorothiazide, 50 milligrams and not micrograms. 50 milligrams, 12.5, 1 tablet by mouth daily for hypertension. Next. The right route of medication. Let's see, hold on, what happened to my slides? Okay. So the right route of medication. If I'm going to ask you, how many do you think that the medication can be administered? Right route, you see in Grey's Anatomy, if you haven't done your clinicals yet because of this pandemic, right route of medication, if you have seen Grey's Anatomy before, so there's a lot. PO, by mouth. You can give the medication by mouth. There are medication that you can give through the nose, intranasal medication. There are medication you can give through the eyes, medication that you can give through the ears, medication through IV or intravenous route. If you're going to the hospital, there's a lot of tubes hanging. Those are IVs. You can give the medication through intramuscular, you're injecting. If you have done your immunization, that's IM, intramuscular. You can give your medication subcutaneously through fats. That's what we call for, like, it's very common for insulin. So I'll give you an idea here. So there are a lot of ways you can give the medication. So we have sublingual, under the tongue. Inhalation, if you're seeing patients with nebulizer machine, it's inhalation. With asthma medication, where you can puff it, inhalation. Intranasal, nasal spray, okay? Do not be overwhelmed with example of medication. You will get through that when you'll be a nurses, okay? You will be familiarized with the medication. Let's just focus on the route of administration. Intravenous, IV, subcutaneous, it's still an injection, but through fats. Endotracheal, I've given medication through endotracheal. Oral route, that's the common, tablets, capsules, liquid. Buccal, you can give it through the cheek. Rectal, you can give medication through the rectal route. We have the very common in my work right now. It's very common that we are giving Dulcolax or suppository. We call it suppository, or we call it Tylenol for fever. For patients who cannot swallow but who refuse to have IV, who refuse to have intravenous route, who refuse to have injection, then we can give it through the rectum, okay, through rectal area. We have also transdermal patch. Later on, if you'll be working in medical surgical area or in an ICU, you will see a lot of transdermal patch. Nitroglycerine for patients who are on pain medication. We have the fentanyl patch. Fentanyl patch for pain medication. We also have the oral for the ears. Intradermal, it's on the skin. Ocular for the eyes. Intraosseous, I haven't done intraosseous. They usually, so the only route that I haven't done yet is the intraosseous and the intrathecal route. Intraosseous is through the bones, and intrathecal route through lumbar puncture. But I have done all of this, and I'm sure that you'll be doing this. Sooner or later you'll be doing this, and after graduation you'll be mastering all the medication administration. So I'm looking forward for that all of you guys will be mastering, you'll be remembering this and you'll be mastering the routes of administration, and it's just like a piece of cake for you. Okay, next slide. The right time. So this is very important. The right time, check the frequency of the order of the medication. Example, the medication is to be given once daily, to be given twice a day, to be given 3 times a day, every 2 hours, and there's every 2 hours as needed, and every day at bedtime and before breakfast. Those are just the right time. Those are just an example of medication, the timing of medication, but you'll be experiencing, or you'll be receiving orders with different frequency of the order of the medication. Like for now, when I work in the hospital before, we have medications to be given every 15 minutes. Now I'm working as a hospice nurse. So just want to give you a quick, overview of hospice, of what a case manager for hospice is. Hospice, when I left the Philippines, we don't have hospice. When I was working in the U.S., when I started working in the U.S., hospice is my first job. When you say hospice, those patients are dying patients. Their life expectancy is 6 months or less. So those are dying patients with cancer, patients with dementia, patients with Alzheimer's disease, patients with Parkinson's disease. So those are my patients now. They are dying. Their life expectancy is 6 months or less. We have medications that we call comfort medications, or EKIT, emergency kit medications for comfort. The examples of comfort medications that we have in hospice, we have morphine. Are you guys familiar with morphine? Have you heard morphine?
Yes.
Good. So morphine, you've heard about morphine. We call it an opioid medication. So we have morphine in hospice, and that's our, we call it, that's the,
Nakasud ko sa
congratulations, nakasod ka sa Zoom. So, all right, I'm sorry for that. So we have morphine that we use for pain. So that's very common that we are giving. So we have orders like morphine 20 milligrams every 30 minutes, PRN, or as needed, for pain or shortness of breath. For those of you who are familiar with morphine, when I started in the Philippines, I haven't seen a morphine in the Philippines. But when I work here in the US, morphine is just like, oh, it's a common drug for pain, morphine. But I learned in nursing school morphine. To check the side effect of morphine is respiratory depression, if you're familiar with that. The side effects of morphine is respiratory depression. But why the doctor in hospice is providing morphine, like morphine for shortness of breath and for pain? So shortness of breath, if you are describing shortness of breath, that is breathing at least in hospice 25 to 35 breaths per minute. So class, do you know what's the normal breaths per minute? I mean, I'm saying class, sorry, students, you're not my students, but do you know the normal breaths per minute? So usually it's between 12 to 20, correct? So more than that, it's shortness of breath. So we always give morphine because it, the side effects of that is it slows down respiration. So that's why we give morphine for shortness of breath. Next. Okay, spot the difference. So acetaminophen, are you familiar with that? Have you heard about acetaminophen? I know it's not common in the Philippines. No, the acetaminophen, the brand name Tylenol. Tylenol, 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 that's the brand name for acetaminophen. We have 325, we have 500, and we have 650. So that's, if in the Philippines, I don't know what is the common pain medication in Indonesia, but when I left the Philippines, the common medications for pain is paracetamol. For here in the US, the common medication is acetaminophen. 500, we have 325, 2 tablets, 500 milligrams extra strength, and we have 650 milligrams. So that's the very common. That is our biogesic here in the US. Acetaminophen. So the spot the difference. If you'll be reading 2 medication orders, you will know that there is a difference in the time, the right time. Acetaminophen 500 milligrams to give the medication 1 tablet by mouth, PO, per RM or by mouth, every 8 hours routinely for pain. So you're gonna give the medications every 8 hours around the clock. If you're giving it at 2 o'clock, what will the next medication dose at 10 o'clock? Okay. And there's also acetaminophen 500 milligrams, 1 tablet by mouth every 6 hours as needed for mild pain, and do not exceed 3 grams per 24-hour period. So it's every 6 hours as needed for pain. You don't give the medications every 6 hours. You only give the medication if the patient needs it, if the patient is in pain. So there are difference. We have the routine medications and we have the as needed medications, okay? Write documentation. Remember, if you don't write documentation, for nurses, this is very important. If you don't document it, you did not do it, okay? If you don't document it, you do not do it. And this is a very common mistake that nurses do, and that can lead to medication errors. So you have to be very careful. If you give Tylenol, document it right away. Do not document it after 1 hour. Do not document it next shift. Do not document it tomorrow. If you give it, document it right away. Why? For example, if you give Tylenol now, Mr. Journey RN gave, let's say for example, let's bump it up, give morphine, 2 milligrams to patient X at 2 o'clock. But Nurse Journey is very busy. He forgot to document the medication. Now came nurse, let's say Joel, and the patient says, Nurse Joel, I want a pain medication. Nurse Joel checked the EMR. Oh, there's the medication has not been given. I'm gonna give it to you, sir. So that's a medication error now. You're double dosing the patient. So give the medication, write the documentation. If you don't document it, you did not give it or you did not do it. So document the administration after giving the ordered medication, chart in a timely manner, verify the route of administration, and any other specific information as necessary. For example, lab values and vital signs. Like you'll be asking, Mr. Guldes, this is very overwhelming now. Why you're talking about lab values and vital signs in medications. Now, it's really hard to tell you, because you will as you work in the clinical areas, you will learn what medications and what lab values you'll be checking before giving the medication. They're very common here in the US. Before giving warfarin, are you familiar with Coumadin? It's a blood thinner. It's called warfarin. WARFAR.
Warfarin.
Warfarin. Okay, that's a blood thinner. If you're saying laboratory values, I have, when I was in the Philippines, I haven't encountered a warfarin value, when I'm working. But here, it's very common for patients who needs blood thinners, patients with atrial fibrillation, patients, who are at risk for heart attack and stroke, and who are at risk for having blood clots. They give warfarin. But as nurses, before giving warfarin, we are checking the INR values to the blood. Later on, you will learn as you will be working. So there are also you can just give, like, okay, the doctor will say, give potassium chloride extended release to the patient. You will say, yes, doc, I'm gonna give it right away. Don't do that. There are certain medications that you have to check first the lab values, and you have to check first the vital signs. For example, the medication, let's give an example. Hypertensive medication, medication for hypertension. You're working in the hospital and the doctor ordered hypertensive medication. You did not check the vital signs before you give the medication to the patient, and the blood pressure is 90/60. Will you give the medication? Yes or no? No. Okay, you're correct. Who's this? I can see you guys are, shaking your head. So it's a no. Okay, that's correct. We have medications where there's like medication parameters. So do not just, I wanna finish my document. I wanna finish my day today. I'm very busy. I just wanna finish and I wanna go home. And then you see the medication. Okay, I'm gonna give it right away. Remember, you have to check also, like, is there a contraindication for this medication before I give it? So there are medication that you check the lab values, and there are medication that you will be checking the vital signs. Vital signs, example, if for again, for hypertension, you have to check if the patient is, what is the blood pressure, because you cannot give PRN or as needed hypertensive medication if the blood pressure is very low. Otherwise, you're gonna, send a ticket to the patient to heaven. So you know what I mean. So you have to be very careful as well. Now you'll be thinking, oh my gosh, it's very hard to be a nurse. It's very hard to be a nurse. There's a lot of medication. That is only for one medication, and I have to check all of these. Yes, you will be doing that. Yes, you will be doing this checklist, but you will be, you'll be in due time. You'll be mastering all of this, and again, it will be just like a piece of cake for you. Right reason. So as nurses, we have to, again, I mentioned it earlier, as nurses, we have to avoid saying, if the patient will be asking you, ma'am, I have a new prescription from the doctor, and the doctor is giving me amoxicillin. What is amoxicillin for? And you'll be saying, oops, I don't know. Let me ask the doctor for that. I'll be back with you, okay? That will be very embarrassing, because remember, even if there are patients, some of the patients, especially the significant others or their family members, they're also checking, they're also testing the nurse. Is she a good nurse? Is she fit to take care is she fit to take care of my family member? Is she safe? Is my mother safe with this nurse? Is my father, is my son, is my daughter safe? So you have to be, there's a lot of medication. You cannot memorize all of the medication, but if you encounter new medication that you haven't heard before, it's just when we were students, we have like the booklets, like the what was it? Nanda is for nursing diagnosis. We have like the pocket drug guide, but now we have the cell phones. We can Google what is amoxicillin for. It's like, oh, 1 minute, amoxicillin, okay? Oh yeah, amoxicillin is antibacterial medication. So it's very easy to say that now because we have Google. We have phones, but before we have like backpacks, and we have like a lot of books with us. So remember, we have to always be prepared for questions from our patients. Nurses spend most of the time with patients than doctors. Remember that, okay? Confirm the rationale for the ordered medication. What is the patient's history? Why am I giving Lasix to this patient? Are you familiar with Lasix? Furosemide. Why am I giving? No, it's a no. It's okay. You will learn. What's your name? No name. Okay. So what is the patient's history? Why is he or she taking this medication? So you have to know. You have to know your patient, not just doing your job for the day. Like, I'm just gonna do the test for the day. After that, goodbye. I don't care. I don't know the patient. You have to know your patients. You have to know the history of your patients. You have to know what medication is he taking. Is the patient taking? How can you endorse the next nurse if you don't know if you don't know your patients? Just like you will see, I encounter my coworker says, what is the patient admitted for? And then your coworker says, I don't know, let me check the chart. Like, you're working for you're almost end of the shift now. You're in your 12 hours already, and you forgot what the patient is admitted for. So you have to know your patients, guys. You have to know the patient. You have to know what medication the patient is taking. Okay, next slide. Okay, the right reason. Be aware of Google MD patients, cyberchondria. So we have Google MD. We have the patients who are looking for, like, I have rashes, and then they're thinking, oh my gosh, I have skin cancer already. So you will encounter a lot of patients that will be asking you questions from 1 to 10. And we call those patients, cyberchondria, or beware, Google MDs. So there are patients like, why am I taking this? Are you sure that you're giving me the correct medications? Are you sure you're giving me the correct information? So there are patients that is reading Google more than the nurse. So you have to be prepared. When I was working in the Philippines, it's true. In the Philippines, mostly, unfortunately, I mean, not all. I'm not. Don't quote on me for this. But based on my experience, patients and what do you call this? Family members, they're scared of nurses. That's um, part true and part wrong, I guess. They're scared of nurses. But here in the US, nurses are scared of patients and scared of the family members because they're asking a lot of questions and they're also so happy. They like to complain. So you will hear a lot of complaints from A to Z. The nurse gave me the medication. I think that's incorrect. So you will hear that. When she gave me the injection, it really hurts. Yeah, you will be encountering those patients too. So, and again, you'll be encountering patients or Google MDs or patients with cyberchondria. It's not a correct word, but it's just like a combination. Cyber means the online world, and chondria from the word hypochondriac or hypochondriac, which means a patient who always think he is sick. He's going to another, doctor hopping. Like for example, I have stomach problem for a couple of days now. I think I have stomach cancer because I read in Google that stomach cancer says you have a stomach pain. Well, girl, you're thinking too much, you know? So those are what we call cyberchondriac patients or patients who are Google MD. They rely their medical diagnoses or signs and symptoms in Google. But as nurses, nurses are educators as well. So that is a very important, aspect of being a nurse, is that because you are always interacting with the patient, you can always provide education to the patients, okay? Not just giving, okay, this is the medication, that's it. Explain the medication to the patient. Why are you giving this medication? Hello, ma'am, sir, this medication is amoxicillin. The doctor is telling you that you have infection of this and that. So this medication is giving. You will be taking this medication 3 times a day, okay? So it's very important providing education to the patients. Next. So again, I hope you have done your pharmacology already because I'll be asking you a couple of questions about common medications that you will encounter. Just nod and shake your head if you don't know the medications, okay? Nod if you know, shake your head if you don't know the medication. First medication, metformin. Are you familiar with that? No. Metformin. Circle? Nod or no? Okay. Metformin, okay, it's very, you will encounter a lot of medication. Metformin, it's for diabetes, okay? Lantus, no, yes, circle. Lantus, that's a form of insulin. It's for diabetes. Okay, these are the common medications that you will see in the ward. Lisinopril, are you familiar? Lisinopril, number 3. Lisinopril, that's for hypertension. Hypertension, okay. Furosemide. Furosemide, are you familiar? No, yes, not. Okay. Furosemide is for Lasix, so let's just make it faster. Furosemide is for, there's a lot of medication. There's a lot of use for furosemide. It can be used for hypertension. It can be used for water retention. If the patient is retaining a lot of fluids in the body, that's what we usually do. Furosemide, we usually give furosemide. Or if the patient is having very high hypertension or high blood pressure, we give furosemide. Albuterol. Raise your hand for those who are asthmatic. It's very familiar. I am one of them. So albuterol for asthma. Okay, you have albuterol? Yes, you do. Okay, pantoprazole. Patients with acid reflux. Acid reflux, in Bisaya, it's kabuhi. Like in the morning, you feel upset stomach always. You always have upset stomach in the morning. We call it GERD, gastroesophageal reflux disorder. You will encounter that with your med surge later. Pantoprazole for acid reflux. Levofloxacin. Levofloxacin is an antibiotic medication usually given for patients with pneumonia. Okay, levofloxacin, usually given for patients with pneumonia. Atorvastatin. Atorvastatin, it's really hard. I was like, oh my gosh, this is very overwhelming now. How can I memorize these medications when I'll be working in the hospital? Well, you will learn a lot in nursing, and you will learn a lot in medication administration. And I am very I look forward for the time that this medication will only be like, again, I'm gonna give this one again, like the medication by heart already. So atorvastatin is for hyperlipidemia, for high cholesterol. Okay, high cholesterol. Robitussin. Oh gee, you don't know Robitussin. You familiar with that? In the Philippines, we call it Robitussin. When I was in the Philippines, we call it Robitussin. But when I was here in the US, the correct pronunciation is Robitussin. Okay, it's Robitussin, not Robitussin. In the commercial, you will say Robitussin DR, but it's Robitussin. Okay, cephalexin. Cephalexin, very common. It's an antibiotic medication. Azithromycin. Azithromycin. Azithromycin, it's an antibiotics. That is the first drug of choice for pneumonia. For community-acquired pneumonia without complication, that is a drug of choice, azithromycin. That's the guidelines here in the US. For patients with community-acquired pneumonia without complications, and if the patient has no other diseases, we give azithromycin. Z-Pak. Levothyroxine, from the word thyroxine, thyroid. This is for patients with hypothyroidism, okay? Next, glipizide. Sorry guys, this will be the last slide for the medication. I know it's kind of overwhelming, huh? There's a lot of medications to remember. Glipizide, it's for diabetes. Ranitidine, Zantac. Are you familiar with that? Zantac, ranitidine. Zantac, ranitidine, it's an H2 blocker, histamine 2 receptor antagonist. So it's for the stomach, for hyperacidity. In the Philippines, we call it hyperacidity. We give Zantac 150 milligrams. Allopurinol, that's very common for elderly, for patients with gouty arthritis. Losartan medications. With your grandparents and grandparents, have you heard your grandparents taking losartan? Losartan. I don't know what's the brand name in the Philippines for losartan, but losartan is for hypertension. Docusate, Dulcolax, Docusate for constipation. 10 milligrams once a day at bedtime. Do not give Docusate in the morning, otherwise you'll be pooping in the afternoon. So it's nice to give medications for constipation at night. So in the morning, when the patient wakes up, he will poop. Clindamycin, it's for antibiotics. Verapamil, it's a calcium channel blocker. You will encounter all of this I'm pretty sure you will encounter all of this medication when you will be working in clinicals and with your pharmacology. Verapamil is calcium channel blocker for hypertension.
Tadi dekat esok lagi aku dah sampai dah. Oh sampai tu tengah walu. Oh barang dari sampai tu nan wang aku yang mana dah. Tak
Okay. Oseltamivir. Oseltamivir. Oseltamivir, that sounds familiar to you? No? Oseltamivir, that's the medication of choice for flu. With a capital F-L-U, flu. Oseltamivir. Nitrofurantoin. It's like, sir, how can I pronounce this? It's very difficult. Nitrofurantoin. It is for UTI, usually given for patients with UTI. It's called macrobid nitrofurantoin. Paracetamol, you know what paracetamol is? Tylenol, acetaminophen, and the last medication, tramadol, for moderate to severe pain. Okay, time check. How are you so far? Okay. Are you okay so far? Nod, and sir, sir's nodding too. So, right response. Make sure that the drug leads to the desired effect. Like I said, if you're giving a medication for hypertension, don't just give the medication. Like you're giving the medication at 8 o'clock. You have to go back to the patient after 30 minutes or 45 minutes to check if it's effective. Okay, the right response of the patient. If you're giving a patient with fever, you're giving paracetamol to patients with fever, you have to go back to the patient and check if the fever is gone, okay? If the patient is in pain and you give pain medication, you have to evaluate if the medication that you gave is effective. Don't just give the medication and goodbye, okay? Give and come back and evaluate if the medication is effective. Next, so let's put things together. Okay, we already know all the rights, okay? The right patient, the right dose, right medication, right route, right documentation, right time. And what about the other rights? I forgot. The right response. So there are usually eight rights, and some are like 6 rights. Please identify if the orders are correct or incorrect. So these are the medications. Nod and shake your head if it's correct or wrong, okay? You nod for correct and you shake your head if it's incorrect. How I wish I can see all the students here. Okay, morphine sulfate 20 milligrams per 1 ml. Give, it's like, oh my gosh, this is a lot to process. Morphine sulfate 20 milligrams per 1 ml. Give 5 milligrams or 0.25 ml by mouth. Sublingual, every 2 hours as needed for pain, for mild pain or shortness of breath. Is that correct? Yes or no? Do we have the right dose? Correct. Is there a dose in the order? Is there a dose in the order? Yes. Is there a time in the order? Yes, there's a time. It's every 2 hours. Is there what's the medication for? The medication is for shortness of breath. Is there a right route of the medication? How can you give the medication? Yes, you can give it PO. PO means per orum or by mouth. Okay, PO is by mouth. And you can give it sublingual. Remember, sublingual is under the tongue. So there is. What about the second one? Lorazepam, 0.5 milligrams. Give 1 tablet every 6 hours as needed. Is that correct? Yes or no? Nod for yes and shake your head for no. So lorazepam, it's no. You don't see what is this for. So it's incorrect. It's a incomplete order because you don't see. You just said you can look at, there's the medication, there's the dose, there's the time, but I don't know what this medication for. Okay, so it should be lorazepam 0.5 milligrams. Give 1 tablet every 6 hours as needed for anxiety. Okay, and paracetamol 500 milligrams, 1 tablet by mouth every 6 hours as needed. That is also incorrect because it did not specify what is this for. It only says as needed, but it didn't say for pain or for fever. Okay, so much for that. We're done with the right routes, with the right rights of medication. Now let's go to polypharmacy and medication reconciliation. When you'll be working soon as a nurse, you will be encountering a lot of medications from 1 to 100, 1 to 20. I have seen patients with 25 and up medication. So we call it polypharmacy. The patient is taking a lot of medications. Now, as a nurse, you have to reconcile the medication. Some patients will go to doctor, for example, Dr. Thomas. Some patients will have 5 doctors, and each doctor ordered pain medication. One doctor orders, for example, tramadol. One medication ordered Tylenol, and one doctor ordered, let's say, a narcotic. As a nurse, you have to reconcile the medication. You will, you have to call the doctor. Doctor, this patient has like 7 types of pain medication. Can we make it maybe 1 or 2? Because the patient has a lot of medication. So as a nurse, you have to remember that. You have to reconcile the medications of the patients, because you don't want to be overdosing the patient with a lot of medication. Because the patient sometimes, okay, I'm going to take paracetamol, biogesic. I still have pain. I will take the narcotic. I will take this medication. So you have to reconcile. Doctor, this patient has 10 pain medications. Can we make it 5? Maybe reduce it or reconcile it so there will be no redundancy of medications. So you can always tell that. Do not be scared. I know it's very, when I was in the Philippines, it is really, based on my experience, really hard. It's really hard to talk to the doctor. Don't quote me on this, but this is based on my experience. It's really hard to talk on doctors. I'm kind of nervous to speak with doctors, but you have to, because as a nurse, you will be taking care of the patients. You will be carrying out the order of the doctor. Do not hesitate to ask the doctor questions. Okay, is it a yes? Do not hesitate to ask the doctor questions for any clarification of the medication orders. Okay. Okay. So the do's and don'ts of medication administration. So you will say, oh my gosh, thank you. We're on the middle part of the discussion, the do's and don'ts of the medications. So you do give the medication on time. Remember, if you don't give the medication on time, that is considered a medication error. Kung dili mo mahatag sa medication on time, that is considered a medication error already, okay? Give the medication on time. If the patient's order is to give the medication in the morning, do not give it in the afternoon, okay? Use only labeled bottles. If you see this bottle and you don't know what this bottle is because the labels are gone, do not give the medication, or you can verify it to the pharmacy, okay? Look at the label 3 times. Again, this is Narcan. Look at the medication label 3 times. When you take the medication from the cabinet, take the medication, okay, it's Narcan. When you pour the medication to the cup, it's still Narcan. And when you put the medication back to the cabinet, okay, it's still Narcan. I'm good. I'm giving the right medication. Correct? Check for the order accuracy. If the order is not accurate, if you're not sure about the order, do not give the medication. Use quiet area to prepare the meds. Don't prepare the meds in the nurse's station. Don't prepare the meds where in front of the nurse's station. You prepare the meds at the back because you'll be overwhelmed with patients asking you questions, family members passing, nurses. Check for, use a quiet area to prepare the meds. Check the ID and allergy bands. And here, it is a common practice that if the patient is admitted in the ER already, if the patient has an allergy, they will already give you a band. They will already give you a band that says allergy. Okay, that is a common practice here. Just when the patient arrives in the ER, it's part of the assessment. Do you have any allergies to any medication? Yes, I'm allergic to penicillin. They will already put you a band, an ID band that you're allergic, but it doesn't specify. It's a red band that says allergy. So when the nurse will see you, the nurse will say, okay, you have an allergy band. I will find out what your allergy is before I give the medication. Because it's very common here that the patients are allergic to penicillin. Know the action of the drug. You know what the drug is for. Again, do not say, I don't know, I'm not a doctor. I will ask the doctor. And document immediately, again, in the medication administration record, initial, sign, and full name. Do not give the medication 30 minutes before and 30 minutes after the intended time. We have medications that should be given before breakfast. Do not give it after breakfast. Otherwise, the medication's effectivity is compromised, okay? Use unlabeled or do not use unlabeled or blurred labeled bottles. Do not forget to do the 3 checks and again, check the expiration of the bottle. And do not assume anything. Like for example, I learned it the hard way. First, when I work here in the hospital, the patient has been prescribed with nitrofurantoin. Furantoins, like furantoin, and it sounds like phenytoin for seizure. And when the patient says, "Why am I given nitrofurantoin?" and I said, "Maybe because you have seizure." And then the patient says, "I don't have seizure. I don't have seizure. Why? What are you talking about?" So I learned it the hard way. I was written up by my supervisor for giving false information to the patient, for scaring the patient that I gave false information because I assumed that nitrofurantoin. Oh, maybe this is nitrofurantoin. Maybe this is phenytoin. Maybe this is for seizure, which is incorrect. I didn't check. I did not verify. I was wrong. I got to write up. Do not talk or be distracted when you're preparing a meds. No chismis, okay? When you're preparing a medication, do not stop chismissing. Don't talk. Prepare the medications without distraction. Do not give the medication if you cannot verify if that is the correct patient, okay? Do not give the medication if you're not sure, if you cannot verify that this is that this is Juan, okay? Do not give wrong information to the patient. Do not be like Mr. Journey is giving the wrong information to the patient. But if you give the wrong information, unfortunately, you have to go and you found out that you give the medication incorrect. You give the wrong information. Go back to the patient right away. Apologize and give the correct information. And do not forget to sign immediately. Signature has to be legible. Again, do not forget to document. If you're not documenting, it means you did not give the medication, okay? Documentation is your legal defense against anything, okay? If you don't document, you did not give. Patient monitoring and education, you have to monitor the effects of the medication and you can, educate the patient. Don't forget, as nurses, doctors, they educate. Do not quote me on this again. Don't quote me on this. They educate, but unfortunately, they can't be with the patient for so long. They will just be there for doing their rounds. But for nurses, you will be there 24/7. So you all have the time to give information, to educate. I really appreciate nurses who are giving education to the patient, not just give it, goodbye, see you again tomorrow. Don't do that. You give the medication, you provide education for the patient, okay? Okay, so we have a little bit of a, I hope I can copy this. Oops, sorry. Oh, hold on, we have some technical difficulties here. Let me just copy. Okay, so I will let you see a video here. Mm. Can you see my video? Not? Good.
Yes.
Yes, sir.
Yes.
I was gonna go get your.
So this is what you're looking for, what you will be, in the future if you'll be working in the clinical fields. This is very common that you'll be giving a lot of medications. There's a lot of, interactions. So for patient safety and medication administration, this is, I saw this on YouTube and this is a good one.
For you.
If you're in the hospital, chances are you'll be taking some medications.
I'm gonna go get your medicines and I'll be right back, okay? Okay.
At Mary Greeley Medical Center, everything we do is centered on patient care and providing the highest quality and safest care possible. Safety in administering medications is a top priority.
It's very important on a couple levels. One, that we're getting the correct medication and the correct dose to our patient. We're administering at the right time, but also that we're educating our patients about what this medication is that they're taking, the reasons why they're taking it, the side effects of those medications.
That's why a group of nurses and pharmacists, along with staff from cardiopulmonary services and quality management, recently teamed up to review how we administer medications.
We bring a team together with people from all different levels and really embrace everyone's input in that process and come up with a new process. And it really then creates buy-in. And when you have that buy-in of your organization and you can just feel it, it's becoming a part of our culture.
A culture of safety with a new 9-step standardized process, plus a red lanyard for the nurse administering medications to wear with a card that reads, "No interruptions."
You almost feel like it's an invisible cape. No one can interrupt me while I'm doing that. And are you allergic to any medications that you know of?
Yes.
It's a pretty big deal to nurses like Brandy Kadolf, who knows interruptions can be common in a busy hospital.
And do you have any questions about these medicines or about their side effects?
She says reviewing this and other processes shows Mary Greeley's commitment to constant improvement and quality care.
They're absolutely devoted to patient safety with administering these medications. It's important to the patient because it ensures that they have my total attention while I'm administering those medications.
We talk about this a lot, but if I'm a patient and if I feel safe and informed, it will decrease my anxiety and I will heal sooner. So it's about our patients. It is absolutely about our patients, and that's what we want.
Okay. Okay, so it's really hold on. Cancel. One more video. I'm gonna show you. Sorry about that. We have another. Gotta share. Can you guys see me? Can you see me? Can
Yes.
you share? Can you see my screen? Okay, go ahead.
Yes, sir.
Before administering any medication, check the Medication Administration Record, or MAR, against the provider's orders. The best way to prevent medication errors is to ensure the 6 rights of medication administration, as shown in that video skill. Begin by reviewing the medication order, which should include the patient's full name, the name of the drug, the dosage, the route of administration, the frequency or timing of administration, the indication for use, if it's a PRN order, and the date on which the order expires. The order must be signed by the prescriber.
Hi, Dr. Jenkins. This is Jessica. I'm calling about Veronica Adams in room 404.
To avoid errors, consult the prescriber about any illegible handwriting, an unusually large or small dose, or an order that seems incomplete, incorrect, or inappropriate for the patient. Once you begin medication administration, don't let anything interrupt the process, and use these error prevention tips for each of the 6 rights. Begin with the right medication, comparing the drug label with the MAR 3 times. Once before removing the drug from the drawer or shelf. Once before placing the drug in a medicine cup or taking it to the patient's room. And once again before administering the drug at the bedside. If the patient questions the medication you've prepared, withhold it until you can recheck the preparation against the order. And if a drug ever seems inappropriate for the patient's condition, check with the prescriber.
I have your thyroid medicine for you.
I usually take this once a day.
Okay, let me check on that for you.
Next, make sure you have the right dose. If you need to calculate a dose or conversion, double check your calculations.
Hi, Cindy, can you verify this with me?
Sure. Then verify them with another nurse.
That's what I got. Okay, thank you.
If you have to administer part of a tablet to ensure the right dose, use a cutting device and split only tablets that have been scored by the manufacturer. If possible, determine if the pharmacy can split the pill or encourage the healthcare provider to order medications that do not require splitting. To crush a tablet, pulverize it and mix it with a small amount of food or a little liquid. If mixing with food, ensure there is no incompatibility. Of course, sublingual, enteric-coated, and time-release medications must never be crushed. The medication crusher should be thoroughly cleaned after each use. To ensure that medication is always given to the right patient, use at least 2 identifiers. For example, check the patient's ID band and then ask the patient to state his or her full name and birth date. If the patient's ID band is illegible or missing, obtain a new one for him.
Mrs. Krasinski.
If your patient is confused or unresponsive, compare the information in the MAR with that printed on the patient's ID band. Make sure you know the right route of administration for each medication you administer. Use oral syringes for oral and enteral medications, and use parenteral syringes for injectable medications. Label all syringes at the point of preparation with the drug, dose, and route. Consult the prescriber immediately if the route is missing. The specified route is not the recommended one, or the specified route is contraindicated for your patient's condition. For example, if the prescriber has ordered a Tylenol capsule for pain in a patient who has become nauseated, ask the prescriber about switching from oral Tylenol to the same drug delivered by suppository. Keeping in mind the right time to give a medication and making adjustments as necessary will also help prevent errors. For example, if a drug is to be given 1 hour after a morning meal, ask a team member when he had breakfast and how much solid food he ate. Then administer the drug accordingly. Or suppose a patient is to receive one drug, Q8H, or every 8 hours, and another drug, TID, or 3 times a day. Since both drugs are to be given 3 times within 24 hours, it makes sense to determine if they can be given together. Remember that a Q8H drug must be given around the clock to maintain a therapeutic blood level. A TID drug, however, is given during waking hours and can be scheduled around the patient's activities. To make sure you prepare the right documentation, Be sure to record all medications as soon as they're given. Timely, thorough, accurate documentation can prevent errors, as explained in the video skill, Documenting Medication Administration. If a medication error does occur despite your best efforts, follow up by reporting it according to agency policy and by intervening for the patient, such as administering an antidote, withholding the next dose, and monitoring the patient as appropriate.
Okay, so for the videos, it is very important. It was stressed there. It is very important to report in case, even if you did everything, all the rights. Okay, I have done all the rights, and you still have, medication. You still did a medication error. Do not make do not make it as a secret. Okay, you have to report it because it can save your patient. Some medication needs an antidote for that, because if it's an overdose, there are medications to counteract the effect of that. So you always have to report it. Okay? Because there's a lot of patients who died because of an overdose because a nurse did not report that the patient is overdosing pain medication. So I have to report that. Now let's get back to my slides. Hold on. Okay, so what are examples of medication error? I mentioned earlier, if you're not giving the medication on time, that it's considered medication error. So if you're giving the wrong medication, that is a medication error. If you're giving the medication on a wrong route, that's a medication error. If you're not if you have errors in doing all the right patient, right documentation, that is considered medication error. So always remember all the rights before you give the medication. But Sir Journey, what about if you're giving like 40 medications in a day? Yes, you still have to do the rights. That's not for the safety of your license. Well, of course it is but most especially for the safety of your patients. Okay. Next slide. Okay, so medication errors, according any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of a healthcare professional, patient, or consumer. Such events may be related to professional practice, healthcare products, procedures, and systems, including prescribing, order communication, product labeling, packaging, compounding, dispensing, distributing, and here it is for nurses, administration, education, and monitoring. If you're educating incorrectly, I would still consider, if you're giving false education to the patient, although it's not part of the rights, but I would still consider it as a wrong information or wrong documentation to the patient, wrong education. So medication error. So there's one more video for that. Hopefully, hold on. Can you see the slide? Am I still on screen share?
Video, yeah.
And was made possible by a grant from the Healthcare Initiative Foundation.
The following is one in a series of nursing simulation scenarios created to educate nursing students and refresh new practicing nurses about situations they could encounter in practice in a simulated context. Complete information about this scenario, from setup to debriefing questions, can be found at www.montgomerycollege.edu/nursing simulations.
Here's Mr. Waters. We're so crazy in the ED, we're on reroute. I'm bringing you another patient as soon as you get him settled. I got the admission database done for you, and his orders are written. He's 65. He's allergic to Levaquin, and he fell at home and has an 8-centimeter laceration on his left arm. Kerlix dressing is dry and intact. He has a history of AFib, hypertension, CAD. His admitting diagnosis is syncopal episode. The vitals for me were 136/84, 98.4, 98 and irregular, 20 and lungs clear, and his SAT is 98 on room air. He's got a 20-gauge saline lock in the right. Everything else is fine. Oh, here are his meds. I took him out, but I didn't have a chance to give it to him. But I'll be back in about 15 minutes, okay?
Okay. An important thing here, did you see the nurse gave the medication to the other nurse? Do not give a medication that is prepared by other nurses. You have to prepare the medication that you will give. Do not receive a medication that is already prepared because you don't know what medication it is, do you? Just like if we were, look.
Oh, here are his meds. I took him out, but I didn't have a chance to give it to him. But I'll be back in about 15.
Now, if your friend or if your friend in the hospital give you medication, can you give this to Mr. Rogers? And you don't know the medication. Will you give it? No, that's a no. Don't give a medication that you don't know, okay?
That's okay.
Okay.
Thanks.
She's doing hand washing. Remember that.
Hi, Mr.
hand
Waters.
washing.
I'm Kelly. I'm going to be your nurse. Can you tell me your date of birth?
Why does everybody want to know my birthday? You know, throw me a party or something? Can't I just get my pills so I can go to bed?
I know you're tired. I'm just going to do a quick assessment, okay? Do some vital signs. And then we can give you your pills. Kelly.
The ED called, said they're on the way with your new admit.
My new admit? No, Mr. Waters is already here.
It's a patient for 346B, Mr. Thompson.
I need to talk to my charge nurse because I just got a new admission.
Well, she's in 341 getting the ICU transfer settled, and I got another call. I've got to go.
Are you having any pain, Mr. Waters?
No, I'm not having any pain. My only pain's from you.
How's this arm?
It's fine. It's fine. No pain. I'm just tired.
Okay.
Can I get my pills?
Let me put this in the computer. It's Kelly.
Lab labels are up for Mr. Waters.
Labs? Weren't they sent to the ED?
I guess not. You want me to bring them to you? No, wait, I got another call. Gotta go.
You done your phone call yet? I'm starved. Can I get a snack? Some crackers or something?
Let me check the computer. You're on a low sodium diet. I'll bring you some juice and crackers.
I want milk and not skim milk. I always take milk with my pills.
Sorry, we don't have any milk.
No milk? Just give me my pills then.
Okay. I have Lipitor, Norvasc, and Coumadin. You take these at home routinely, right? So you know what they do?
Of course I know what they do. Coumadin thins my blood.
Mm-hmm.
Lipitor's for cholesterol and Norvasc for my pressure, okay? You just get on with it.
Okay. Let me scan your bracelet, okay? All right, Mr. Waters, here you go. These are your pills, and here's your water. Hey, it's Kelly.
Your patient's from the ED's here. They need some help to get him into bed in room 345.
Okay, I'll be there soon. Is there anything else I can do for you, Mr. Waters?
No, I just want to go to sleep.
Here's your call button. You want me to turn the lights off for you?
Yeah.
I'll be back in 30 minutes to check on you and do some labs, okay? Mr. Waters, it's Kelly. I'm here to draw some lab work on you that the doctor ordered. Mr. Waters? Mr. Waters?
What? Oh,
Wake up.
you again.
I'm here to draw some lab work on you.
Ah! Oh my God! I'm bleeding. What do people do to me?
It's okay, Mr. Waters.
Ah! It's everywhere.
I'm here.
Ow!
It's okay.
Ow! Oh my gosh, my nose? This never happened before.
Okay, it's all right. I'm here. I'm gonna put some pressure on it, okay? Hi, this is Kelly. I need some help in room 346. My patient's hemorrhaging.
Oh,
It's okay.
hey.
I paced the doc. Mr. Waters, I'm going to help you.
Take care of it. I'm gonna take care of it.
Mr. Waters, I'm here, okay? We're here to help you.
Take some vital signs.
Get me out of here.
Okay, Mr. Waters, we're here to help you, okay?
Stop that bleeding.
That's what we're doing. Putting pressure, okay?
What'd you do? Give me too much medicine? Never happened before.
Hi, it's Kelly.
I've got Dr. Youngblood on line 1.
Okay, thanks. Yes, Dr. Youngblood, we have Mr. Waters here at MCGH Hospital with huge amounts of bleeding from his nose and his left arm laceration. The dressing saturated, his pillow and his gown is saturated. Blood pressure right now is 90/50, heart rate is 130. He's alert and responsive.
Get me out of here.
Yes, that's him yelling right now. He came from the ED about an hour ago, admitted with syncope. He fell at home and lacerated his left arm. Vital signs 30 minutes ago were 130/78, heart rate of 104, respirations of 18, saturation of 98% on room air. His labs are pending. He's hemorrhaging right now, and I think you need to come and see him right away.
Say, Mr. Waters, he was just in my office this morning for a routine checkup. He seemed fine. I ordered some labs. Let me check those. Oh, yes, an INR of 4.3. Well, that explains it. Give him vitamin K, 10 milligrams, sub-Q stat, and I'll be right over.
Okay, let me read those orders back to you.
Okay, so there are a lot of errors that this nurse has done. Okay, first, again, do not receive medication that you don't know from from other nurses. But the thing here, she gave the medication, although it's warfarin, it's the correct medication, but you cannot give warfarin if the INR is increased, because the side effect for that is the patient will bleed. Okay, if the INR is 4.3, you will know INRs later. I don't want to discuss further because you will be like, this is pure pharmacology. So remember, I told you earlier that you will be encountering a lot of labs before you give the medication, and you'll be encountering you'll be checking vital signs before giving the medication. For warfarin, for example, if the INR is increased, you don't give it's 4.3 elevated, do not give warfarin. Okay, you can call the doctor. What will be the dose, doctor? Because if the INR is elevated, you'll give warfarin or Coumadin, the patient will bleed. So that is the mistake of the nurse. She did not check the labs. She did not verify. There was a call earlier about the labs, but she just, the other person over on the other line is also busy. So there's a lot of interruptions, and plus you're giving the medication, although it's a correct medication, but it's not intended at that time because the patient's labs are not good. So those are example of that. Unfortunately, but fortunately, the patient is bleeding, but not too much. But what if there's like intestinal bleeding? So you could kill a patient by just not looking at the labs, not checking on it. Okay, so it is very important. You have to verify. You have to be mindful. And first, you have to know your patient. Don't just go to the hospital or work without knowing the patient. You have to know the patient. You have to know what the patient is, what are the diseases of the patient. You have to know what are the history of the patient, what is the chief complaint of the patient, why he or she is in the hospital. So you will know what the patient is taking, what the medication is for, and it will help a lot in preventing medication errors. Okay, let's go back to my slides. Did you any questions so far from students? Okay, thank you. Let me just go to my slides. Okay, medication errors, we're done with that. Okay, question for this. On your right side, do you want to give those medication? Do you want to carry it out? If you're a nurse and you receive an order for that, what will you do? You will give the medication? I don't even know what the medication is. So I can't give that medication. The order is M. There's like #100, and then there's POQ day. I will not give the medication. I don't even know what the medication is. You have to ask your doctors, okay? So medication error can occur at any time, at any point in the pathway from prescription onwards. Many errors have been found to occur at the point at which the prescription is actually written. So as a nurse, if the error starts from the documentation, you can't read the document, you can stop it. You can stop the error there. You can stop the problem there from making it into an error. So you have to verify it with a doctor. If you don't read, I can't read the order, so I'm gonna call the doctor. Do not hesitate. What will you do? I don't know what the medication is. So you have to verify and ask, okay? Again, how do we prevent medication errors? By following the what? The 8 rights, okay? The rights in medication administration. That is how to prevent the medication errors. Next. Okay, are you familiar? Question. Nod or shake your head. Are you familiar with EMAR, Electronic Medication Administration Record? I haven't seen that when I was in the Philippines in 2014. I went here in the US in 15. I haven't touched any EMAR. We are doing paper documentations. But the trend now, in safe medication administration is by using electronic medication administration record. Okay, that is safe because there's a time that it will pop. There's a lot of it really depends. If you're talking about EMAR, you're talking about an iPhone versus a Samsung. There's a lot of programs. There's a lot of websites. There's a lot of programs or systems that the hospital is using. Just like a Microsoft, or you're going to use Google Chrome from, there's a lot of EMARs, examples of EMAR. So this is what an EMAR is. Okay. Electronic Medication Administration Record. It is a technology that automatically documents the administration of medication into certified electronic health record technology using electronic tracking sensors, for example, radio frequency identification, or electronically readable tagging such as barcoding. If you see, from the videos that I shared with you, they're using a barcode scanner. Okay, it transmits go directly to the electronic medication administration record. So, for example, this is patient Lee Kelly with so this is not correct. Let me see. Okay, this one for Lee Kelly, EMAR. So Keppra for seizures and amoxicillin. September 10, 2 a.m. it was taken. You documented it. It's all computerized. Wednesday, 12 a.m. patient was taken. It was taken. Friday, 3 a.m. taken, and at 10 o'clock the patient refused. So you can put everything in medication administration record or EMAR. Amoxicillin, for example. So EMAR is very good. The advantages for that is like if you're going to encode or you're going to put all the medications in the EMAR or electronic medication administration record. I hope you will encounter like clinics or hospitals with EMAR because you will really appreciate the value of technology for safety.
Excuse me for a while, sir.
Yes.
Your presentation is not viewed, sir, in the meeting, sir.
Oh, I have to share it. Let me see.
Yes, sir. First, the YouTube page, sir.
I'm sorry?
Mark, stops on YouTube, sir, then present kagbalik, sir.
Okay, let me, sorry about that.
Okay, sir. Then share screen again, sir, with your presentation. Okay,
How about that? Can
that's
you
sir.
see?
Yes, sir. We're able to see, sir.
Okay, good. Sorry about that. I didn't know. Okay, so are you familiar with electronic medication administration record? So this is what it is. EMR, or it's a new technology of giving the medication to safely administer the medication, and it limits or mostly stops the medication errors, okay? Let me see. Oops. Okay, EMR, a technology that automatically documents the administration of medication into a certified electronic health record technology using electronic tracking sensors, for example, radio frequency identification or electronically readable tagging such as barcoding. If you see the video earlier that I showed you, they're using EMR. There's a computer with the patient's record on it, the medication that the patient has, it was already encoded there. They're using the barcodes, so you just have to, scan the medication. It automatically pops up in the computer, and it says administered, and it's all checked. So you will not forget, and then it will be, it limits the medication errors. Example, can you see? Example, so this is an example of an EMR. Again, there are a lot of EMRs. If you're talking about EMRs, there's a lot of systems. So this is one of the systems. Keppra, amoxicillin. So like there's a record. The patient takes amoxicillin at 2 a.m., at 12 a.m. on Wednesday. On Friday, 3 a.m., she took the amoxicillin, and at 10 a.m. the patient refused. So you will know. So every time you don't want to be this is a improved version of paper documentation, because if the one who's writing is, if the nurse who is writing is writing it not, you can't read the writings, then it's very hard for you to understand. But for EMR, it's all computerized. The disadvantage of EMR, as to a lot of technology that is there's a chances of we call it hacking. So we have to have a good IT technology in the hospital to prevent that. Another thing is, are you familiar with HIPAA? It's HIPAA in the US, HIPAA, we call it HIPAA, do not talk or do not share information of your patient to other people unless the patient is directly, unless that person is directly taking care of the patient, directly involved in patient care. Just like, in short, nurses, please no chismes with your patients, okay? Especially you're talking about your patient in the canteen or in the cafeteria. Oh, patient one has STI. So don't do that, okay? Patient, for example, patient De La Cruz has an STD and he's taking these medications. Do not do that, okay? Do not share information. So for EMR, there's a tendency of, if you don't have a good, if the system don't have a good information, IT, shield on it, then there's tendency of hacking as well and leaking of, so don't share any information. EMR goes only in the computer, don't take a picture. As like you say, okay, there's a computer. I'm going to room 20 there, I'm gonna take a picture. What's this one? Don't take a picture. So you will have, okay, so this is you and this is that. Don't do that, okay? So that's the advantage and disadvantages of EMR. It's all in the computer. And one advantage of that is when you put all the medication of the patient, if you write all the medication of the patient, it will automatically do a drug-to-drug interaction. So it will have a drug-to-drug interaction. So if the patient has 20 drugs, after encoding all the medication, after saving all the medication, it will pop up. Morphine is having a drug-to-drug interaction with Ativan. Ativan is having a drug-to-drug interaction with this and that and that. So you can tell the doctor, morphine is having a drug-to-drug interaction with this medication. Would you like me to stop one of this, or would you like to change the medication? That is safe. Unlike if you're writing all the medication in paper without like you're writing 20 medications. As a nurse, do you want to check each medication for a drug-to-drug interaction? It's very time consuming, and you have 20 patients. Okay, so for the EMR, that's one of the advantages I like, because after you encode all new admission, you encode all the patient, pop, so you will know the drug-to-drug interaction. Another thing with EHR, or electronic health record, is that if your medications and your conditions are already encoded in the system, it will populate, it will generate to other, like for example, if you're going to the pharmacy, like here, based on my experience, they already know, oh my gosh, you have this kind of medication. If you're going to another doctor, it will populate your medications that you're taking. So it will not, if I'm a new doctor and I see you in the first time and you were seen by another doctor previously, I already know what medications you're in. I can verify it, and then I will not order the same medication twice. The patient will be confused. For example, I'm going to order you have losartan 50 milligrams, and the new doctor ordered losartan, like say for example 100 milligrams, and you as a patient, oh, I'm going to be taking losartan 100 plus losartan 50. So you have a double dosing. So that's also one of the advantages of electronic online system and that I really appreciate the technology. The technology, it really helps a lot based on my experience in preventing medication errors. So in medication here in California, before a facility, you will get incentives from the government if your company is using an EHR or an EMR in your facility, because specifically the Center for Medicaid and Medicare Services, or the CMS, they will give you incentives for people, what do you call this, for facility or for hospitals who are using EMRs. So certification and standard criteria of EMR. So still, again, there's the right patient there, the right medication, the right dose, you encode the right route and the right time. All the rights are still there, and it's in detail. So yeah, this is a good, hopefully, it will be a trend. I mean, Philippines, they're using EMRs, but not all. Unlike not all, hospitals or clinics are using that. We are still living unfortunately, in paper documentation. I'm not saying paper documentation is not good, but EMR also saves time. It saves a lot of time, and it really is good in preventing medication errors. So now, this will be the last topic of my discussion. I hope I didn't bore you. So narcotics. If you're talking about narcotics, I specifically wanted to, choose narcotics in my topic because it's one of the common drugs here in the U.S. that's abused. Because unfortunately, some doctors will just give it just like a candy to the patient. I have a headache. Let's say the patient will say, I have a migraine headache for example, I have a lower back pain for 2 weeks. Doctor says, okay, I'm gonna give you a narcotic. The good, it should start with ibuprofen, non-narcotics first. Remember, the good thing, you have to give non-narcotics first, then non-narcotics, ibuprofen, paracetamol, Tylenol. If you're going to give narcotics right away, the patient's tendency, they will be usually getting addicted to it. Narcotics are addicting. It's opioid. If the patient is taking narcotics uncontrollably, they will be addicted to it, okay? As a nurse, it is very important that we are gonna, check the patient, assess the patient for addiction. It is unfortunately that a lot of patients who are addicted to narcotics, and also a lot of them died because of narcotics. So in the hospital, who among you guys, I mean, have you seen narcotics before, or have you given any narcotics? Maybe I haven't seen narcotics when I was in the Philippines, just to be honest. I mean, based on my experience as a nurse. So narcotics is inside a narcotic cabinet, okay? All the narcotics are in the hospital are inside a narcotic cabinet. It is double locked. You cannot get a narcotic alone. You have to be two. You have to be two nurses to get a narcotics in a nurse's cabinet. Narcotics are controlled medication. It is recorded in a drug enforcement authority. It is a controlled medication. It is recorded who's the doctor who prescribed this narcotic, how many did he prescribe, when did he prescribe. It is all controlled, okay? It is inside a medication cabinet. Do not get the if you have the key, do not get the medication by your own. You have to have another nurse to get it. And of course, you're in front of a camera. So I've given a lot of narcotics in the hospital. Two nurses, there's a camera, say hello to the camera. We're getting the narcotics, okay? So what are narcotics? Safety, narcotic pain medication, administration. What are narcotics? So example, oxycodone, hydrocodone, morphine, fentanyl. You might not see it for now, but you will really come across to those medications. These medications are highly addicting, okay? Oxycodone, hydrocodone, morphine sulfate, and fentanyl patch. These are addicting. I've given all those medications. Morphine, I've given morphine IV. I've given morphine sublingual and morphine tablets. I've given all those medications. IV, morphine, I've given those. This is an opioid medication from opium, so it's very addictive, okay? It's narcotics. Narcotic abuse. In the US in 2018, data shows that every day, 128 people in the United States die after overdosing on opioids. So there are 128 people died in the US in 2018 every day by opioid addiction. The Centers for Disease Control, CDC, estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion in a year. So I have seen patients going back and forth to the clinic who wants to have a prescription of opioid. Why? Because maybe they're getting addicted to it. It is very important as nurses to provide education, okay? You have to provide education to the patient. We just have a patient who are given a controlled medication, and she took the medication. We gave the medication 30. The patient has 30 medications. And then what do you call this? The doctor prescribed a medication. The good thing here is that all the medications are controlled. We have what we call cures, or a record, a database that records all the medication that is dispensed from the pharmacy. Who's the doctor? Who is the patient? Even if there are different, for example, I'm a patient, Journey. I went to Dr. Yakkum and Dr. Thomas. I went to Dr. Yakkum, for example, Monday. I was prescribed with morphine 30 tablets. And then a week after that, I'm going to Dr. Thomas, and I'm going to be asking another medication, another morphine. And then Dr. Thomas says, let me check. I'm going to go to Cures. Let me check. Oh, so there's a database for that here. You were already seen by Dr. Yakkum last week, and you received 30 tablets of morphine. What are you doing here? So, we use Cures. I'm gonna show you what Cures is, what it is. So it records everything from specially controlled medications. So opioid overdose crisis in 2018, roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them. Between 8 and 12% develop an opioid use disorder. An estimated 4 to 6% who misuse prescription opioids transition to heroin. About 80% of people who use heroin first misuse prescription opioids. And the increase in injection drug use has also contributed to the spread of infectious disease, including HIV and hepatitis C. So there, you will really encounter a lot of patients who are addicted to opioids, and we are, some of these patients are sent to a psych. Some of these patients becomes, a psychiatric patient. Some of those who goes to rehab. In the Philippines, when I was in the Philippines, I only know of an addiction from shabu. But here in the US, there's a lot of addiction like for pain, because of mishandling of the pain, and the patient was not, guided properly, no education, no monitoring and education. They dispense 30 medication, but the patient finished the medication in 2 days or in 3 days, okay? So it is very important. But now, because of the abuse of the opioids, they're giving it like for example, you have acute pain of the lower back. You have pain in your back, and you went to the doctor, and you were given pain medication for like opioid pain medication. They will only give you a dose for 3 days. Just like maybe if you're taking it every 8 hours as needed, 3 times 8, they will only give you 3 times 8 is 24 doses. Sometimes the doctor will only give you 10 doses, just enough for acute phase. So, oh, sorry, I'm wrong. So it's if it's every 8 hours, so you're taking 3 tablets in a day, so you'll be taking 3 times 3, so you'll only be given 9 tablets total. So in 3 days. So role of nurses in preventing opioid abuse. What is your role, nurses, for preventing abuse of pain medication? Number 1 is education. Role of hero nurses. We are heroes, okay? Let's claim it. When you graduate, we are here. Even if you're a student nurses, you can provide education to your patients, okay? Screen patients for drug abuse. Patients who are drug abuse, they're always seeking for medications, okay? I was working in the hospital. The trend of this patient, he knows that he will be receiving hydromorphone every 6 hours, but the order is as needed. But he knows that. If you will give more hydromorphone at 12, dilaudid hydromorphone at 12 noon, at 5:45 in the evening, he would already call you. Call lights on, and the patient will say, "Where's my pain medication?" And he is smiling. Do you think the patient is in pain? Do you think the patient is in pain? You gave the medication at 12 noon. The next dose, if he is in pain, at 6 o'clock. At 5:45, call lights on. You will go to the room. The patient will say, where's my pain medication? And he is smiling. As a nurse, will you give it? But remember, pain is subjective. Whatever the patient says, he is experiencing, the pain is subjective. A nurse cannot gauge. Pain is subjective, and there are also objective cues. Subjective is if I will say I'm in pain, I am in pain. You have to accept that I am in pain. But then, as nurses, you also have to check if the patient is really in pain. Why is he smiling? So you have to educate the patient. Sir, if I'm gonna continue doing this, you'll be addicted to the medication. Okay, it's only 5:45. You know that's every 6 hours, and you're asking for the hydromorphone again. You'll be addicted to this. Another option for that, you have to call the doctor. We have to start tapering the patient. If the patient is taking 20 milligrams of morphine, for example, we can start lowering it down. You can tell the doctor, "Hey doctor, I think this patient is starting to get addicted to the medication because he is seeking the medication, almost every time, every 6 hours. What are we gonna do? Doctor says, okay, explain to the patient this and that, and maybe we can start lowering the medication dose until the patient will have 0 narcotics, okay? That's how we lower down the medication. 20, 15, 10, and then 5. So for narcotics, the very common side effect for that is drowsiness. Drowsiness, and the adverse effect is, when we say adverse effect, the bad effect of the medication, adverse effect, is respiratory depression, okay? Before giving the morphine, we all know we have to check if the patient, we have to check the breathing of the patient, the vital signs before giving the medication. It's very important. As nurses, don't just give the medication by giving it. Remember, you have to know the medication by heart. If not by heart, you have to research on it if it's a new order. And you have to check the labs and check the vital signs, okay? Assess the patient carefully. Pain medication should be matched to the individual's patient's needs. Educate the patient. Nurses need to educate patients about the role of pain medication in their care. This education should include pain medication options and the reasons why non-opioids are preferred. For example, you ask the patient calls you, call lights on, 5:45, I'm in pain. How much is your pain, sir, from 1 to 10? 4, would you like to get ibuprofen instead? Because you have a pain medication, you have an order of, in the Philippines, Alaxan. You know Alaxan, right? Alaxan FR. For students, would you like to get ibuprofen instead? Ibuprofen is this and this. You have to explain, you have to sell the medication to the patient so he will not be addicted to it, okay? In order to prevent from getting the opioid. Example of narcotic pain medication. So this is morphine, sublingual. This is a medication very common in hospice. We give patients who are dying, we call it terminal restlessness, terminal agitation, terminal shortness of breath, and terminal pain. I've seen patients breathing 40 breaths per minute. After that, we changed stroke respiration. So while we orders from the doctor, it's okay. For hospice patient, don't quote me on this, but based on my experience, we monitor the patient, but the comfort of the patient, if the patient is dying, we wanna make the patient die comfortably. We are giving morphine. There's an order for like every 1 hour as needed, or every 1 hour routinely. So we are giving pain medication. I've given a lot of, a pain morphine to a dying patient. I'm on bedside until the patient expired. It's a different area in nursing that I've learned here in the U.S. I didn't learn in the Philippines because we don't have hospice, right, Sir Joe? We don't have hospice in the Philippines, so we have a lot of dying patients. We're giving morphine. You will see the patient breathing, especially if the patient is having cancer with terminal pain. They're in severe pain, and we're giving morphine, breathing rapidly, and then slow respiration until, they die peacefully. That's really hard at first. When I work in hospice, it's really a hard. I did not grasp the field of that field right away because I'm not used to it. I haven't even touched what morphine is. But when I started working on it, it's like, okay, yeah. I mean, I realized the importance of comfort care to a dying patient. So we give morphine to make the patient comfortable, especially in severe pain, severe shortness of breath, and terminal restlessness, agitation. And we also give Ativan or lorazepam together with morphine. So sometimes we use it as a cocktail, but of course we get the orders from them. But we did not kill just to make it clear, we did not kill the patient with morphine, okay? I know the side effect of this is shortness, respiratory depression, but we did not kill the patient with morphine. We just give the morphine to make the patient comfortable while he is transitioning to death. Okay, so this is very common. If you'll be working later on, in the fields of hospice, this is also an, I will not say interesting because it's very sorrowful. It's they're all dying. I will not say interesting, but you will learn a lot from this too. This field of nursing, hospice care. So much for that. So how much morphine should I give? Remember, if your patient is asking for a pain medication, you have to find out these questions. So how much morphine should I give? You need to do thorough pain assessment. Thorough pain assessment is key. So you will ask the patient, onset, when did the pain start, ma'am? Okay. Location, where is the pain? The pain is in my back. It started 2 weeks ago. Duration, how long will you feel pain when there's a breakthrough pain? How long will it last? If I will feel the pain, it will last for 2 hours. Okay. Characteristic of a pain. Tell me how you asked. So tell me how the pain feels like, or describe the pain to me. I think this is an aching pain in my back. It's a dull pain. So there are different types of pain: dull, aching, sharp pain. Aggravating factors. Do you know what time of the day the pain? You experience the pain, and what triggers your pain? Oh, the pain is triggered when I am moving from sitting to standing, or when I am bending down. It hurts a lot. So that's the aggravating factors. Relieving factors. So what relieves your pain, ma'am? Okay, maybe when I'm taking ibuprofen and when I'm doing a massage in my back, the pain is gone. So that's a relieving factors. Treatment. Are you taking any medication to pain? Oh yeah, the doctor gave me pain medication, oxycodone, last week. Okay, so you have oxycodone already. That's a good thing. I will tell the doctor that you already have an oxycodone. So the doctor will not prescribe you another medication. It will be double. Okay? So remember this, old carts, OLDCART, old cart, and also do not forget your pain scale. From the scale of 1 to 10, ma'am or sir, what is your pain? Tell me. 1 as having, 0 as having no pain, to 10 as having severe pain. Maybe I would say 5. Okay, moderate pain. You will check. Okay, doctor. You will call the doctor now. Doctor, patient Juan experienced pain 30 minutes ago on his lower back, and he described the pain as a dull pain. It is aggravated when he is moving from side to side, and it relieves when he is relieved when he is laying flat on bed. There's no treatment for now. His pain scale is 5 out of 10. What would you like to give, doctor? Please advise. Okay. Okay. The doctor says, okay, doctor. Okay, nurse Journey, give. This is the order: oxycodone, for example. Okay. Let's just say morphine, 2 milligrams every 4 hours as needed for pain, for mild to moderate pain. So you have, when you're asking a patient for a pain, remember the old cart: the onset, location, duration, characteristic of pain, aggravating factors, relieving factors, treatment, and don't forget your pain score. Now let's go back to the patient who has a call light at 5:45. Call light 5:45, you're going inside. Yes, sir, what happened? Okay, you have to ask, he will say, I have a pain. Okay, you will not give the medication right away, okay? You have to ask the patient old cart style, okay? So that will also prevent, abuse of giving the medication. And before administering narcotics, ask for any drug allergy. There are patients who are allergic to morphine and I would say anaphylaxis. Anaphylaxis is you can't breathe. You know, your bronchus are constricting. You can't breathe because of the allergy for narcotics. As for drug allergy, assess the level of pain before administering the pain medication. Remember, assess the pain medication, assess the level of pain, old cart and pain scale, assess vital signs, especially the respiratory rate, and morphine can lower down the blood pressure as well. So you have to assess that. And educate about common side effects, which is nausea, vomiting, and constipation. If you will come across to you know, a patient who is taking narcotics, it is also prudent. It is prudent to ask the doctor, doctor, the patient is taking narcotics. Would you like to prescribe stool softener? Because you know that constipation is a side effect of morphine or narcotics. So it is also okay to ask that. And again, I mentioned earlier about cures, or controlled substance utilization review and evaluation system. That is what we are using here in California. That every patient who is taking who's taking narcotics, their names will be recorded in the cures website, and the doctor who gives the medication, how many tablets the medication, how many tablets was dispensed, or how many is the quantity that was given. So the next time, because there are patients who are like doctor hopping from one doctor to another to get pain medications. So cures, this helps, you know, patients from getting addicted. So if you come with, if there's a new patient who goes to your clinic with a chief complaint of pain, or who goes to the emergency room with a chief complaint of pain, they will ask you, they will check, are you taking narcotics before? What medications you're taking? And they can check your name through the Cures website. And oops, boom, you were given medication last week. Why are you asking for another medication right now? So as nurses, you can also educate and counsel the patient about drug addiction and pain medication abuse, okay? So that, I think that ends my webinar for today. I hope you learned. And I will, you know, for questions, raise your hands and I hope I have answers. Do you have any questions?
Thank you very much, Sir Journey, for the very informative discussion. And I hope the students are listening also till the end. Okay, so let's proceed to the open forum. Then, Sir Journey, I want to read first the question in the chat room. So,
oh, yeah, chat room. Hold on. Oh yeah, there's a lot of questions here. Sorry about that.
In the chat.
From Anissa Salsabila from Jogja, Bethesda.
There is a question from Anissa Salsasiba.
Yes, Sister Joel.
Yes, he is asking, because we mentioned about drugs that are given and are not supposed to be given. So I think her concern is, what are the effects if the dose is high of metformin?
Oh, what are the effects if the dose is high of metformin? Okay, for metformin is for diabetes. Metformin is one of the safest drugs. So metformin is the first line of drug or drug of choice for diabetes. If you're diagnosed with diabetes, the doctor will start you with metformin. It's one of the safest drugs for that. But the effect of that, if you're overdosing metformin, is low blood sugar. Your blood sugar will collapse. Okay, so you will, if your blood sugar will collapse, you will also collapse. You don't have energy. You will be unconscious. So that is a common effect of metformin if it's in high dose. The common side effect of metformin, the very common side effect of metformin is upset stomach and diarrhea. Okay, that is a common side effect of metformin. So a good, especially if the patient is taking metformin, you know, is taking the metformin for the first time, a nurse should follow up how is metformin doing with you? Are you okay with that? No side effects? So yeah, that is a very common side effect. So I hope I answer your question.
Thank you, Sir Journey. I want the students to ask questions.
Yeah.
Then, okay, so also here in the chat room, another question. Okay, allow me to read the question.
Yeah.
From the live chat in the YouTube. Ruth Rezaline, a nurse that prescribe medicine. That is the doctor's job. Should a nurse also learn about medicine?
Yeah, of course. A nurse cannot prescribe a medication. That's correct. It also depends on the country of origin. Philippines, nurses cannot prescribe. Here in the US, we have nurse practitioners who can prescribe medications. I'm a nurse practitioner student, so later on when I graduate, I can prescribe a medication. I can check, I can function like a doctor do. So your question, but that is the doctor's job. Should a nurse also learn about medicine? Yes, because you will be carrying medicine, not on the medicine course to be a doctor, but medicine. If whatever you give to the patient, you have to learn the medication. Like I said with my discussion earlier, you have to find out what medication is. That's part of the rights. What the medication is for. Okay, why are we giving this medication? You have to know what medication is for, because when your patient asks you, like based on my experience, nitrofurantoin, what is this for? And I said for seizures, because it sounds like phenytoin. So yes, you have to, know what the medication is, and you will learn that when you will be working in the clinical fields, and I hope your clinical instructor will be asking you a lot of drug studies. Is drug studies still going on, right, for students in the clinical areas? That's what I learned when I was a student.
Yes, sir. We do have drug therapeutic record or requirements.
That's correct. So yeah, you do not give the medication. Like as students, you have to learn. Your clinicals is your way of learning.
Yes.
Your way of learning. Your way of practicing to give the medication. So it's really important to know medications. If you encounter a new medication, you have bring your book, scan it through the pages. Okay.
Another question, sir, from Mr. Cañete. Mr. Cañete.
Yes.
Is Bryson?
I only say good morning here.
Mr. Cañete, you can now ask your question.
Good morning, sir.
Good morning. Yes.
I'd like to ask lang, sir, if how would you ask po if the doctor has no complete orders but regarding the medication?
Oh yeah, that's a tough question to ask the doctor, huh? Because you're scared. I forgot to put the video. I forgot to put the video here according to when Henderson was interviewed by one of the doctors. Like the point of the interview was like, according to Henderson, why would you be scared to ask the doctor questions? But in fact, you're the nurse. You're 24 hours with a patient. You're taking care of the patient. You have to clarify what the order is. So how am I asking the doctor? It's kind of hard. So for example, I read losartan. I'm always taking, because I'm taking the medication. Metformin 500 milligrams, one tablet. One tablet. Metformin 500 milligrams, one tablet, for example. You can just ask, doctor, I would like to verify, I received an order electronically, and I would like to verify how many days would you want the patient to take the medication, doctor? That's it. It doesn't say, you don't have to, hey doctor, your medication, order is wrong. Don't confront the doctor like that. You just say, "Hi, doctor. Good morning. This is Journey. I received an order this morning regarding let's say patient Gulies, and you wrote metformin 500 milligrams, doctor. I would just like to verify how many tablets would you like the patient to take in a day?" So that's how you ask the question. Do not correct the doctor, but you can just ask or verify. Did it make sense to you?
Thank you, Sir Journey. The next to ask a question is Miss Ginocor, Lisa Ann. So you may now deliver your question.
Is it good morning, sir? Good morning. Is it okay to administer like 2 drugs even if that 2 drugs is or has the same indication? Like for example, levetiracetam and lacosamide. Is it okay to administer it to a patient?
It really depends. It really depends upon the medication, because there are medications for example, hypertensive medication. There are patients who are taking 2 hypertensive medication. One is to protect the heart, and one is for the, there are different actions of medication, but they have the same effect. But one medication is good, protects the heart, and one is for the other purpose. So yes and no. No, if you think that the medication overdoses the patient. Yes, if there's a good effect on that. So if you're not sure about it, it is always important to ask the doctor, "Hey doctor, I have 2 medications here with the same action. Would you like to reconcile this medication? Would you like to put it into one?" For example, I have losartan hydrochlorothiazide. For patients with hypertension, the initial dose, the initial drug of choice for patients with hypertension is hydrochlorothiazide, diuretics. That is the initial drug. That is a drug of choice. If it's not working, the doctor can pair it to losartan and hydrochlorothiazide, but they are doing the same effect to lower down the blood pressure. So those are combination drugs. Okay.
Thank you, Ms. Ginocor, and thank you, Sir Journey. Another question in the chat room from Mr. Chuganko, George Crispin, or Crispin George. Losartan is a maintenance drug, but I had experienced and witnessed it was stopped because the patient have a low blood pressure. So when taking losartan, does the patient need to check their BP before taking the maintenance drug? If we're talking about maintenance medication, sir?
Yes. For patients who, it is really important, it is vital, it is part of the education of nurses. If the patient is admitted for hypertension and was discharged home, you always include in your education that the patient will do a monitoring of blood pressure morning and night. So it is always that. And like here we are admitting a patient, especially I am hypertensive myself. So the doctor told me, okay, the first initial dose of hydrochlorothiazide that he gave me, you have to have like a blood pressure journal day and night. After that, follow up with me in 2 weeks and how you're doing with the medication. So yes, I would recommend, or I would educate the patient to please monitor your blood pressure morning, afternoon, and night. We encourage that.
Thank you, Mr. Chubanco, for that question. Another question is from Miss Monje. Miss Monje, are you around?
Sir?
Yes. Now ask the lecturer.
Sir, good morning, Sir Nurse Journey. My question is, why if mag-stop o long-term na drug therapy, why will it cause myocardial infarction and hypertension? And it's usually seen, when I read the book, it's usually seen sa cardiopulmonary drugs. Why does this cause myocardial infarction and hypertension. Thank you, sir.
Okay. So, oh my gosh, this is an NCLEX question. Okay. Usually for patients, especially for long-term, for patients who's taking long-term medication, chronic, your system is already used to the medication. You already have a good control of the medication. Your system is already, your circulatory system is already in control of the medication. If you stop it, if you stop right away, what will happen? It will be, there's a possibility of a rebound or a reversal of it. And increase, remember, increased blood pressure is one of the reasons for heart attack and or stroke. So yeah, your body's used to it. You stop it, it will rebound, or there's a adverse effect from stopping the medications.
Follow up lang, sir.
Yes.
Kanang, it's usual naman in the Philippines and low-income countries na the patient who cannot afford the drug will self-diagnose. I mean, lessen the dose of the drug. Then it will it cause? Will it have? Yes, of course it will have other kind of effects. Pero it will lessen the drug
Potency?
therapy of the drug therapy.
Mhm.
So what is the best method, sir, nga dili siya other ways na we can prevent this from happening, sir?
That's a tough question because yeah, financial status and is really important, factor in medication, in taking the medication compliance to the patient. Some patients are not compliant because they can afford the medication. That's very, that's very sad to think about it, if you think about it. But man, giving me a hard question. Oh, okay. If the patient cannot really afford that, then what you can do is there is like what we call, I don't know if it's recommended by the doctor to give like supplements or like herbal preparation, and especially diet, weight loss. You can educate the patient. Well, if it's hard for you to maintain the medication, then better be good. You just say it better be good. Lose weight, diet. Diet is very important. Even if you're taking a lot of the most expensive drug, but if you're not compliant with your diet, then your drug is like, you're useless. So I think that's the least you can do. Educate the patient with diet, exercise, and with losing weight. So
Thank you, sir.
Thank you, Ms. Monde. Sir Journey, another follow-up question from Mr. Chuganko, Chris Vindraj. Regarding the maintenance medication, is it dangerous if you only take maintenance drug losartan when you have a high blood pressure?
is it dangerous?
Yes, sir.
Yeah, is it dangerous if you only take the maintenance medication? If it's controlled, then you only need maintenance medication. But if your blood pressure is not controlled, you need to have a PRN1 and as needed medication for blood. So hydralazine, you can add hydralazine or clonidine for that. But when you say it's dangerous, it's not if it's controlled. If your blood pressure is controlled with the medication, then it's not dangerous. But if it's not controlled, then it is dangerous, and you need follow-up medication, as needed medication for that.
Thank you, Sir Journey.
Mm-hmm.
Sir Akub, can you have a question from our friends from Indonesia if they have questions?
Yes, I would like to entertain questions from our school counterpart in Bethesda, Yakkum, Dr. Nerlia. What about our students in STIKES? They have some clarifications or like a follow-up question or their experiences in giving medications. Dr. Nerlia,
Yes, Dr.
Yes.
Joel.
Yes. Are there any questions from our students in?
I think it's enough. No more.
Okay.
Yes,
Uh,
that's all, Doctor. Thank you very much for your opportunity.
yeah. There is another question from the chat room for our speaker. In the Philippines, Miss Yunson mentioned that is there a specific room for preparing medicines, especially in public hospitals? I think this is new to them because they are not exposed yet now due to the pandemic. They're supposed to be sent to hospitals for this time, but because of again COVID, we are prohibiting them from going. I think I think Steve P can answer this, or yes, because he had also an experience in the Philippine hospitals.
Okay, that's a nice. Is there a specific place in the room? It depends upon. It really depends on what hospital you're in. To be honest, nurses station. You eat in the nurses station. That's your kitchen. You prepare in the nurses station. That's your med room. But technically, you prepare the medication in the med room. Okay, the medication room. Um, but I cannot say because I haven't been to a lot of government hospitals in the Philippines, but the ideal room for that is in the medication room. Prepare all the medication in the medication room. Here in the U.S., in the hospital that I work with, it also depends on the protocol of the hospital. Here in the U.S., I like their system is because every room there's a medication cabinet for each patient. The pharmacist will fill out the medication cabinet on a daily consumption. So if the patient is taking, for example, metformin every day, once daily, he's going to put the cabinet only one metformin. If the patient is taking pain medication, PRN, every 8 hours, the pharmacist will only put three PRN pain medication. By the end of the day, the pharmacist will remove all the medications that were given. Now, the pharmacist will compare. There are one remaining medication, pain medication, from the medication cabinet. And Nurse Journey only documented one PRN narcotic, one PRN medication. What happened to the one who took the medication? So that's, in my setting here, we have the medication in the hospital that I work with. We have medication cabinet per patient in every room. So it's more safe. The medication is there, and the auditing of the medication is also good. So, but again, go back to your question. It really depends on what hospital you're in and what's the protocol of the hospital. Technically or ideally, it should be in the medication group.
Yes, I think we can. Yes, I think we can entertain this last question, sir.
Yes.
With regards to this is from Mr. Philip Malaloyon. He is asking for the sequence, perhaps, or the actions that a nurse can perform whenever the patient refuses to take the medication. So this is, I think the sequence, or if there is sequence or chronology, or what are the succeeding activities that a nurse can do if the patient refrains from taking medication.
Based on my experience and based on protocols of the hospital that I work with, we usually we encourage the patient 3 times. 3 times. If the patient did not take the medication the 3rd time and he refuses the medication the 3rd time, we are going to document on the EMR the patient declined the medication. Risk and benefits were discussed to the patient. After discussing the risk and benefits of the medication, the patient still refused the medication, period. So you have to include in the documentation, this RN, gave the medication 3 times or attempted to give the medication 3 times. The patient declined. Risk and benefits were explained to the patient. the patient still continues to refuse the medication. So I think you're covered by that. And then after that, you're going to call the doctor. Doctor, patient X refused the medication, blah, 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 blah. Okay, the doctor says, okay, just monitor the patient for any adverse effect. Okay, you go back to your EMR. This RN call the MD, blah, blah, blah. And then after that, the MD informed this RN that to monitor the patient continuously, blah, blah, blah. We'll continue to monitor the patient for any adverse effect by refusing the medication. So that's how we document.
Sir Journey, there's another last question, super last question from the YouTube, or viewers of the YouTube. So this question is from Miss Jimena Angalos. Good morning, sir. I would like to raise a question. What should you do if the previous nurse before your shift forgot to give the medication to the patient?
The previous nurse forgot to give the medication. Usually we call, technically you can call the nurse that you forgot the medication. There's a lot of things. In my experience, I don't want to give the medication because it's not on my time. You're not working. For example, you're working at PM shift and they forgot in the morning. Don't give the medication in the afternoon because it's just supposed to be in the morning. Otherwise, it will be considered a medication error. You have to report it to your supervisor that the medication was not given by the previous nurse, and you have to report it to the doctor. I know it's a long process, but this is very important because it's the safety of the patient. So you have to, you can follow up with the previous nurse. You forgot the medication. You can report to your supervisor, and you can inform the doctor that the medication, especially if the medication is very important, the medication was not given by the previous nurse, but do not give the medication. Okay? I hope I answered your question.
Yes. Okay. Thank you for that. No more question? I think there's none. Dr. Nurulia?
Yes, Dr. Joel?
Yes. Any words or any questions if there is?
Yeah, thank you very much for amazing today. Thank you very much for Dr. From Sir Gules. It's amazing and awesome speaker. So I also thank you for Visayas State University. We can collaborate in this session, and then in the next we can have collaboration, nice collaboration in the another topic. Thank you very much for our participant to join in this seminar. Thank you, Dr. Joel.
So thank you, Dr. Nurulia. Let's now proceed to the last part of the program, the awarding of certificate to the resource person. So allow me to share to the screen the certificate. Okay. I'm just gonna share.
He opens it.
Oh.
Okay, so can you now view the certificate for dear participants? Sir, makita ra? Really? Really? Okay. So okay. For a while, sir, because we're sharing the screen, the certificate. One, sir.
Yeah. Oh, wow. Thank you.
This one, sir.
Yeah, I can see it.
Okay, so allow me to read, sir, the citation. Visayas State University College of Nursing, in collaboration with the STIKES Bethesda Yakkum, Indonesia, presents the Certificate of Appreciation to Mr. STP Journey Maraon Gules, Case Manager, Advantage Health, Riverside, California, in recognition of his valuable time, expertise, and facility as resource person or resource speaker during the cross-country webinar with the theme Drugs, Do's and Don'ts on Evidence-Based Practices, Contemporary Trends in Nursing Pharmacology in the Safe and Affirmative Practice Environment for Aspiring Nurses. Given this 11th day of November 2020 at Visayas State University, Philippines. Signed, Dr. Joel Ray U. Acob, and from STIKES Bethesda Yakkum Head, Dr. Vivi Retno Entening, SCAP and SMAN. Thank you very much. Let's give a word of applause to our resource person.
Thank you so much. And it's a pleasure to share with you my experience in nursing here abroad.
So thank you very much, Sir Journey. To close or to formally close our webinar, may I call on Dr. Joel Ray U. Acob, the Dean of the College of Nursing, to address the closing remarks.
Thank you so much, STP, and I hope to see you when you come back in the Philippines. You can visit us here.
Hope COVID ends.
Yes, and also to our friends and counterparts in Indonesia. We have the head, Vivi, and Dr. Nulia, to the Dean of Nursing in Indonesia. Thank you so much for this opportunity. And this, for sure, this would not be our first and last collaboration, because we have a lot of programs to work with. And for November last week, we'll have your activity also, and we will support your activity. And also with our research collaboration with our students for third year. We will be working with an international research with your students and ours as well. Yes, we have actually in YouTube, there is like around 300 viewers, and there are also questions coming from there. And we're able to address those concerns from our YouTube viewers. We also have like participants from Netherlands and in Great Britain, and they're asking if they can have the certificate. Yes, we will give you the certificate to all the attendees. We have shared our link in YouTube and in Facebook, and also in our Zoom room. So thank you so much, STP, and also to Norlia for always supporting each and every one of us in our activity. I think we can have our photo opportunity virtually. I think we request everyone to please turn on their camera so we can capture the best images of both countries. Dr. Nulia? Yes, I think we can have the picture taking now.
Okay.
Okay. First page ya, halaman pertama.
No.
Okay. Wait. Okay, 1, 2, 3. Okay. First page. 1, 2, 3. Wait. Okay, next page. Okay. 1, 2, 3. Only 2 pages. 1, 2, 3. 1, 2. Okay, enough, Amalia.
Enough?
Yes.
Thank you.
Thank you, Sir Joel. Thank you.
Yes, we will, for the participants, we will, please click on the link for the attendance so you can also receive the certificate for this webinar. We'll also send our e-certificate to our speaker in a while.
Thank you so much.
Thank you so much, Tip.
Bye-bye.
Bye, Dr.
Bye.
Nalia.
Stay safe. Stay away from COVID.
Yes.
Safe.
Thank you
We'll
so
have a
much.
meeting,
Salamat po.
Nalia, maybe like next week. I'll just inform you if my Wi-Fi will be okay.